let's go over and look at Parkinson's disease here. Number one, to go through this. All right, it's a neurodegenerative disorder which leads to progressive degeneration of the motor function due to the loss of dopamine producing brain cells. So again, a neurotransmitter, a dopamine, so critical in that pathway. When it's not working, then you have these, again, disordered movement disorders and stuff like that. It's the second most common neurodegenerative disorder, the most common movement disorder. It progressively will come to loss of muscle control, trembling of the limbs and head while at rest, stiffness, slowness, impaired balance. And as the symptoms worsen, it becomes difficult to walk, to talk, and to complete simple tasks. So the progression of Parkinson's disease and the degree of impairment varies from person to person. Many people with Parkinson's disease live long, productive lives, where others disabled and much more quickly. So welcome to the world of biologic diversity. What that means is we're all different on the outside, we're different on the inside, we're as biologically different as our fingerprints. And so the complications of Parkinson's, such as falling and related injuries or pneumonia, because we're not getting good, muscle function of getting negative expiration or basically how we breathe. And so we do think that it shortens life expectancy. Usually it affects people, over 60, but there can be onsets between 20 and 40, or juvenile onsets before the age of 21 are all possibilities. It's been around for a long time. Description of Parkinson's disease dates as far back as 5000 BC, and there's an ancient Indian civilization called the Kamvata, and treated it with a plant containing therapeutic levels is what is now known as levodopa, and which is one of the prescriptive medicines for Parkinson's. It was named after Dr. James Parkinson in 1817, first described the disorder and related to shaking. So it's one of the older diseases in modern medicine. We're going back, 205 years. We're not sure exactly why. There could be a genetic and environmental factors that are involved, and some genes have been linked to the disease. Looking at some things. So there's no specific test for diagnosis of Parkinson's disease. It's based upon medical history of the signs. So again, a stone face, a shuffling gait, difficulty to control movement patterns, a physical examination, and a lot of how it's monitored is with some imaging, an MRI for brain function. They're looking at those. Those are usually done every, 3 to 12 months, depending on the patient's progression. But really, here's what we start seeing: tremors, stiffness, slowness, impaired balance, shuffling gait, anxiety, depression. It can affect your ability to recall. And most people diagnosed, they're again 60 plus, life expectancy, long productive lives, a couple different stages that go through: mild and do not interfere with the person's quality of life, stage 1. Stage 2, symptoms worsen and daily activities become more difficult and take more time to complete. And stage 3, mid-stage Parkinson's, losing balance, movements more slowly, symptoms impair daily activity like dressing, eating, brushing teeth. And then stage 4, severe individual needs assistance in performing daily activities. Stage 5 is full-time assistance. So again, looking at different tests, a SPECT scan or a DAT scan is how they're looking at it. There's no real specific blood tests for Parkinson's disease, but they want to rule out all the other conditions. And in my opinion, like, this is where you can balance out blood chemistry. So a couple different considerations for Parkinson is, let me get up here, is some peptide therapy. So I was asked to do an update on Parkinson's. And Dr. West, what would you do to treat Parkinson's? So the first thing that I would do for Parkinson's is what I do for everybody. Like, we want to try and balance everything that we can, do a medical examination, look at the blood chemistry, look at the hormone results, see if there's any infection component, ruling out any type of chronic viral infection like an Epstein-Barr or herpes 1, herpes 2 infections, cytomegalovirus virus, making sure, like, is there any of those indicators? And if there is, let's turn on the immune system and help the thymus gland, which is the gland that helps with cell-mediated immunity. Let's help to get that to turn on. and let's clean up the system. My favorite scientific paper, British Journal of Medical Practitioners, says that chronic infection, bacterial, viral, leads to neurodegeneration, neurobehavioral, psychiatric, autoimmune, and fatiguing illness. So that's stage one. Stage two, or treatment phase one. Treatment phase two is you just want to get as many healthy fats inside of the system, particularly our medium chain triglycerides like your coconut oil, your avocado oil. If you're not allergic to eggs, egg yolks, beef stew, chicken noodle soup, like I just want to put tons and tons of fat inside of the system and avoiding the bad fats and avoiding inflammatory foods. So whether it's cancer, whether it's Parkinson's disease, whether it's neuropathy, whether it's macular degeneration, like I don't want any fats inside of the system if we can help